With that, I'm going to turn things over to Mala, Mala is an associate professor in the Department of Pediatrics with UW School of Medicine and Public Health. And, she's done a lot of work in quality improvement and advocacy, both locally, statewide, and nationally, really. But what is most beautiful about Mala? Well, there's a lot of beautiful things about Mala, but the energy and the passion she brings to wanting to spread integrative health within the our pediatric patients and our pediatric population. So I am so grateful. I've already learned so much from Mala and the work she's brought to the Osher Center. So I'm excited to hear what she has today. And she is such an incredible resource for us in general. So, all right, Mala, I turn it over to you.
Thank you so much, Greta. I'm going to go ahead and just share my screen. Does that look okay, Joe and Greta?
Perfect.
Okay, wonderful. Okay, well, good morning, everyone. And I'm really so honored to be here today speaking to friends and colleagues. So I am an integrative pediatrician, and I'm here today to talk about pediatric mind-body medicine. I don't have any disclosures except that I love to garden and love being outdoors. So you might see some of my garden and some of my pictures of my travels in this presentation. So in terms of the objectives today, it's really to describe mind-body medicine as a part of pediatric integrative health and to recognize how mind-body therapies can be utilized within our healthcare system and really identify ways in which mind-body medicine can impact health and well-being in children. And so the roadmap today is really just to kind of introduce pediatric integrative health and mind-body medicine and specific therapies that we'll kind of go over in terms of what the literature shows for mindfulness and meditation, yoga, and clinical hypnosis as it pertains to children. And then just briefly looking at current and future directions for mind-body medicine in general and locally here at UW. And I just wanted to describe a little bit about how my interest in integrative health and mind-body medicine really stems from this sort of lifelong interest in movement, initially with dance that I did as a child and in college, and then really being drawn to classes like dance therapy. And when I had children, I really enjoyed prenatal yoga and started a regular yoga practice, and eventually did some certifications to teach yoga to children, and then also the 200-hour yoga teacher training certification. And I've kind of brought this to my research and academic work, and I'm just so grateful that I'm able to, that I was able to pursue an integrative medicine fellowship through the Osher Collaborative and then get some additional training in clinical hypnosis. So just really connecting the dots. This is how I've sort of woven my passion in my academic and professional work. So just wanted to start from the beginning, sort of pediatric integrative health. Where are we at? What's happening in this area? And what do we know? And just to kind of put our discussion into context, and as we discuss mind-body therapies, I thought it would be helpful to look at how mind-body therapies are categorized by the NIH, contextualized within other integrative health approaches. And so this is a schematic diagram of how the National Center for Complementary and Integrative Health characterizes different integrative health approaches. And many of you have seen this before, but there's drugs and natural products, nutritional approaches, and then there's mind-body approaches, which is this really large bucket here. And that incorporates things like mindful eating, but also mindfulness and spiritual practices, psychotherapy, meditation and breathing techniques, art, music, and dance therapies, movement like yoga and Tai Chi, but also physical approaches like osteopathic, manipulative medicine, and acupuncture. So you can see there's considerable overlap, and mind-body practices is quite a big category. And many of you are also aware that the CDC leads a national survey that's conducted about every 5 years since 1957 and asks questions about a broad range of health topics. And the past few years, surveys have also asked questions about integrative health usage in children. So I thought we'd just look at that and see, what do these surveys really show us? So we don't have all the data yet from the 2022 National Health Interview Survey regarding integrative usage in children, but we do know from the 2012 National Health Interview Survey that 12% of children had used an integrative therapy over the past year. And then in a national survey that some researchers at UW conducted through Qualtrics in 2022, we asked the same kinds of questions and found that 32% of respondents indicated that their children had used an integrative therapy over the past year. And the most common conditions that children used therapies for in the 2022 survey we did were to promote health, to increase energy, to reduce stress, to enhance sports performance, and to alleviate headaches. The survey results also reveal inequities in how we access certain integrative health therapies. So, for example, in 2017, it was noted through the National Health Interview Survey that non-Hispanic white children were more likely to have used yoga and chiropractic care than non-Hispanic Black children or Hispanic children. So I think that's something we need to keep in mind and as we move forward in promoting integrative therapies for children. So in the UW National Survey on Integrative Health, we had asked about 2,000 parent participants and also we also asked some additional questions about the parents' interest in learning about integrative health therapies and what therapies are, how they would like to receive these services. And what we found is that 65% of parents were interested in learning more about integrative health. And of those respondents who wanted to learn more, 75 wanted to learn more from their healthcare provider, and 99% wanted to receive those services within their clinic. So this suggests that parents in this survey wanted their healthcare providers to be knowledgeable about integrative health approaches and were willing and wanting to receive those services where they receive their healthcare. And looking specifically at mind-body medicine, what we have seen is an increasing trend to use integrative approaches and therapies, as well as specific increases in certain therapies like yoga and meditation. So from 2012, there have been increases in the use of yoga by children from 3.1% in 2012 to 12.6% in 2022. And similarly, the use of meditation has increased from 0.6% in 2012 to about 7.1% in 2022. So based on the data of the national surveys, in summary, here's what we know, that there's an increasing use of integrative health therapies in pediatrics in general, and specifically there's an increasing use of mind-body therapies, particularly yoga and meditation. And a majority of parents are interested in learning more about an integrative health approach and therapies. And most parents wanted to receive those services in their own healthcare clinic. And we know that there's health equity concerns. There's inequitable access to many of these therapies. So just in terms of the mind-body connection, our mind and bodies are always connected, and stress in one area can lead to stress in the other. And this is why mind-body therapies can be very helpful for so many conditions. And the effects of stress are really bidirectional. And so this is why addressing, the psychological components of a disease or condition is really critical to the healing process. And relieving stress in the mind can be felt in the body, and relieving stress in the body can be felt in the mind. And hopefully we experienced a little bit of that this morning with our meditation. But mind-body interventions can include a variety of different therapies, including yoga, dance, movement therapy, art therapy, tai chi, various forms of moderate aerobic exercise, meditation techniques, mindfulness-based practices, music therapy, creative writing, narrative medicine, deep breathing exercises. So it's really kind of a heterogeneous group of different kinds of therapies across many different domains that help promote sort of emotional expression. And mind-body therapies really just focus on the interaction between the mind and body with the intent to use the mind to influence physical function, mental health, and directly affect overall health. And complementary therapies we might use in our healthcare system are things like yoga, meditation, mindfulness-based stress reduction, hypnotherapy, guided imagery, biofeedback, and all of these embrace this concept. So how mind-body therapies actually work, it can be conceptualized by this diagram from a paper by Grasser and others who created this framework using research that's been done so far in this area. And so looking at on the left-hand side and this colorful top part, the kinesthetic and sensory therapies, so like movement-based therapies, can decrease inflammation and increase endocannabinoids. And these perceptual, affective, art therapy, creative writing can promote emotional regulation in the brain. And these cognitive or symbolic therapies like mindfulness or psychotherapy can really foster dialogue and meaning making. And so I thought this was a really interesting way to sort of conceptualize a framework of different ways that mind-body therapies can be effective. And a growing body of research is also focused on identifying the neurobiological and physiological mechanisms underlying, the therapeutic effects of mind-body practices and suggests a wide variety of effects. So, for example, neuroimaging studies in youth suggest that mindfulness meditation is associated with structural and functional changes in neural networks involved in self and emotional regulation, attentional control, and self-awareness. And mind-body practices can also affect autonomic regulation and immune reactivity and modulate activity of several neuromodulatory systems, including serotonin, norepinephrine, dopamine, and endocannabinoids. Mind-body research in general suggests that these therapies are safe, but really research is ongoing. So what do we know about specific mind-body practices and the evidence base? According to the National Institute of Health, there's an increasing evidence base building for mind-body practices, and there's suggestion that acupuncture may be helpful for chronic pain, low back pain, neck pain, osteoarthritis, knee pain, can reduce the frequency of tension headaches, prevent migraine headaches. Meditation can help reduce blood pressure, symptoms of anxiety and depression, symptoms of irritable bowel syndrome and flare-ups in people with ulcerative colitis, can also help with insomnia. Tai Chi seems to be able to improve balance and stability, reduce back pain and pain from knee osteoarthritis, and really improve the quality of life, especially for people with heart disease, cancer, and other chronic illness. And then yoga, the research is really showing that it may benefit people's general wellness by relieving stress and supporting good, healthy habits, improving mental and emotional health, but also can affect sleep and balance, can help people with low back pain, and can affect the quality of life for people with chronic disease. So I wanted to share that many professional organizations now have sections on integrative health, and I'm a member of the section on integrative medicine at the American Academy of Pediatrics. And we have a clinical report about mind-body therapies in children and youth. And this is really a great reference for those who are interested in the evidence base for and to learn more about the most commonly used mind-body therapies for children. Children and youth are more likely to use mind-body therapies for a variety of conditions, but especially if they've experienced pain-related conditions or emotional, behavioral, or mental conditions, and if they received, specialty or mental health care. And the most common reasons to use the mind-body approaches are for just overall health and to feel better, to reduce stress or relax, for general wellness or disease prevention, and to feel better emotionally. So just a quick note about children and stress, because we don't often talk about how stress impacts children and children's health. And just a note about, do children even have stress? But yes, they do. And there are many health effects of stress for adults and kids, and including, impairing functions of the immune system, um, increased inflammation, decreased bone density, problems with memory, weight gain, fat deposition. It can lead to increased resistance to insulin, increased blood pressure and triglycerides and blood clotting, poor sleep, fatigue, worsening of mood, and adopting less healthy habits. So I think we all can recognize the effects of stress. Um, and children also experience this. So I wanted to just share this resource, which is the Roadmap for Resilience, which is a report that was developed by the Surgeon General of California um, in 2020. And it's their research informing the public health approach to supporting resilience for children and families who experience stress. Um, and just wanted to share this sort of reminder of the stress response. So there's positive stress. So if a kid is having a test at school, or there's a playoff game, a big sports event, that's stressful, but it's considered positive stress, and our body can quickly recover. And then there's tolerable stress, which is, a time limited stress, where you get the activation of the stress response, but for a certain period of time. If children are move, or there's immigration, or there's a natural disaster. And then there's toxic stress, which is a really maladaptive response to an intense and sustained stressor. And this is things like abuse, neglect, household dysfunction. And so this is defined in that roadmap for resilience. And what's also interesting is it's not just the type of stressor, it's the duration of the stressor, the intersectionality, so the number of adversities and how they intersect with each other, the type of adversity, and also the developmental timing, or the critical period of timing when kids develop that stressor. So there's certain critical periods where stress has a more significant impact on health and well-being. And that can affect the child in childhood, adolescence, and eventually into adulthood. So this is just a little bit about the pediatric stress impacting the life course. So again, we talked about sort of psychosocial adversity, and knowing the time that it affects a child, whether it's prenatally or early childhood or later on. And then there's biological changes, so epigenetic changes, neurodevelopmental disruption, the reprogramming of stress and immune regulatory systems. So it could be a systemic or cellular level, or at the DNA level. And it can really lead to, in adults, increased risk of cognitive deficits, disease, psychopathology, and social problems that they experience as an adult. But what I thought was really wonderful in this roadmap to resilience is that this diagram here, where they talk about tertiary prevention strategies in healthcare for childhood stress. So access to nature, mental health care, supportive relationships, quality sleep, balanced nutrition, physical activity, but they include mindfulness practices. And I just thought that was really exciting to have mindfulness practices as part of the public health framework for addressing stress in childhood. And this is just another, way that they describe buffering the toxic stress response. So again, looking at immunologic ways using meditation, because meditation was specifically called out as a tool to decrease the production of inflammatory cytokines and increase T cell production of anti-inflammatory cytokines like IL-4. So it kind of just helps us to see that all of this work is connected, and using mind-body therapies to prevent the health effects of toxic stress in children is really now part of our public health approach. And I think many of you know about this NIH handout on chronic stress. This is not specific to kids, but it calls out mindfulness as one of the techniques, along with slow, deep breathing and progressive muscle relaxation, which can contribute to the relaxation response and lead to decreased heart rate, blood pressure, oxidative stress, stress hormones, inflammatory cytokines, muscle tension, and can decrease elevated blood glucose. Okay, so I'm going to just focus a little bit on a couple different mind-body approaches. One is mindfulness and meditation in children. And so, um, meditation has a history that goes back thousands of years and really refers to a variety of practices that focus on the mind-body integration to calm the mind and enhance overall well-being. And some types of meditation involve a mental focus on a particular sensation, such as breathing, a sound, a visual image, or a mantra, which is a repeated word or phrase. Um, but other forms of meditation include the practice of mindfulness, which is, you know, involves maintaining attention or awareness in the present moment without making judgments. And programs that teach mindfulness or meditation may combine these practices with other activities as well. And I think most of us are familiar with the mindfulness-based stress reduction and mindfulness-based cognitive therapies that are available. Um, and so just looking at the research trends in mindfulness research in children, what we've seen is that there's been a really increasing amount of research in mindfulness and how it can impact children over the past 20 years, with really positive outcomes suggested for reducing stress, improving focus, regulating emotions, and self-awareness. And research indicates that mindfulness practices can help children reduce stress, and especially having an early childhood focus. There's a really growing interest in incorporating mindfulness practices in early childhood education, recognizing the potential benefits for young children's development. And then there's brain development implications. So studies are exploring the neurologic changes associated with mindfulness training in children, suggesting potential positive impacts on brain regions related to emotional regulation and executive functioning. And so that leads us to clinical applications. So mindfulness interventions are being investigated as a tool to support children with challenges like anxiety or ADHD and behavioral issues. And so while this trend is promising, researchers still need to further explore the most effective mindfulness techniques for different age groups and develop robust long-term studies on the effects of mindfulness practices in children. So this is, I just wanted to share a couple of articles. This is a systemic review of the current literature about the efficacy of mindfulness techniques used by mindfulness-based programs on the cognitive, socio-emotional, and academic skills of children aged 6 to 12. So there were 29 studies in this systematic review. 9 were randomized controlled trials and 20 were quasi-experimental. What this shows is that the evidence for improving cognitive skills and socio-emotional skills was reasonably strong. Unfortunately, the randomized control trial did have a high risk of bias, and so not conclusive, but these further research is definitely needed in this area, but the results are very promising that it can be helpful for children. And then this is another study that was done to ameliorate the negative effects of stress and trauma among low-income minority middle school and public school students in Baltimore. And there were 300 public school students, 5th to 8th grade, and they were divided into 2 groups. One had health education and one had a mindfulness-based stress reduction 12-week program. And what they found is that the students who were in the mindfulness-based stress reduction program had significantly lower levels of somatization, depression, negative affect, negative coping, rumination, self-hostility, and post-traumatic symptom severity, which they did through surveys. So what we know is that there are many, school districts who are using mindfulness now as a part of their school curriculum, including here in Madison. And these studies help to add to the literature that confirms some of the benefits and adds to this evidence base. It can be a beneficial way to impact children's mental health. So I also wanted to highlight just another study. This was a recent one done in JAMA Pediatrics in 2022. comparing the effectiveness of mindfulness-based stress reduction versus escitalopram for the treatment of anxiety. And this was done in adults, but I think that there's some real lessons that we can learn here. But in this randomized controlled trial, adults that were diagnosed with anxiety were recruited at 3 US hospital sites in Boston, New York, and Washington. And one group received the mindfulness-based stress reduction 8-week class with 2.5-hour sessions weekly and 45 minutes of daily home practice. And then the other group was treated with escitalopram, an anti-anxiety SSRI medication that was started at 10 milligrams orally and then increased to 20 milligrams daily at 2 weeks if they tolerated it. And then they did some outcome measures, which were surveys that were completed by clinicians and then also surveys completed by the patients. And what they found is that based on their statistics looking at non-inferiority, the 2 interventions were shown to have similar amounts of benefit. So the authors were able to conclude that the MBSR intervention was non-inferior to the SSRI intervention. So I feel like this is very promising and really could have implications for how we treat our adolescents and even younger patients with anxiety. So although I've just highlighted a few of the studies out there, the evidence base for mind-body interventions and particularly mindfulness is growing. And a recent review article sort of summarized the research suggesting that, mindfulness may lead to improvement in emotional self-regulation, attention, self-esteem, and self-acceptance. And this can be really useful for conditions such as anxiety, acute and chronic pain, depression, ADHD, school stress, conduct disorder, and sleep disorder. So this is very exciting, and in the future, hopefully we'll be able to make more of a significant impact on the physical and mental health of children. So this is just how do we support mindfulness in the clinic? So one of the ways that I do is through just breath awareness and other grounding techniques. So I use this a lot with children and families frequently in my primary care pediatric clinic, and I'm sure many of you are using this technique with children in your life as well. But just inhaling for a count of 4 and exhaling for a count of 8, or any 1 to 2 combination that feels right, and doing this several times. And it can be a really incredible way to teach children to in the moment to bring their body towards a state of relaxation as we sort of elevate that parasympathetic nervous system response. And the tracing of the hand is commonly used with children as a kind of a fun way to sort of count the number of breaths without actually having to count them. And then another deep breathing technique, which many of you are aware of, is box breathing. And I use this as well. And what's really nice about some of these breathing techniques is that you can do it in the office with parents. And oftentimes it's very helpful for parents. Sometimes I have learners, so I have residents or students, and we all do the breathing techniques together, which is really fun and very relaxing as well. And then the 5 senses grounding technique. So again, this is another technique that you can bring that kids are really love this. They're always curious and engaged. And so, asking them what are 5 things you can see and 4 things you can feel, touch, 3 things that you can hear, 2 things you can smell, and 1 thing you can taste. So these are just small things that we can bring to our practice. I also talk about different kinds of apps and websites, but Mindful Powers is an app that helps to build socio-emotional learning through the power of play. Smiling Minds is an app developed by psychologists and educators to use mindfulness and positive psychology strategies for children. Insight Timer has many guided sleep meditations and other resources for parents and children. And then Sesame Street's Think, Breathe, Do is a research-based app that teaches children how to calm down and sort of solve everyday problems with more clarity. And then there's a couple of websites that I recommend as well. I'm going to switch gears now and talk just a little bit about yoga, which is another mind-body therapy that can mitigate stress and its effects on the mind and body. So just briefly, we know that yoga comes from yuj, which means union or to join. And Really, therapeutic yoga is the practice of uniting the mind and body and spirit through mindfulness of breath and body postures to really improve stress, coping, lessen pain, and improve specific health conditions. And it's really more than the asanas or poses, right? And in traditional Hinduism, it's really a blueprint of how to lead your life. So yoga originated in ancient India, but came to the US when Swami Vivekananda gave a speech about yoga and the unity of the purpose of different religions as part of the World Columbian Exposition in 1893. And yoga really takes advantage of the innate body systems that can help healing by bringing awareness to different parts of the body, and using that awareness to sort of influence autonomic functions, heart rate, brain waves, blood pressure, which can be really powerful, as we think about how we can use yoga to reduce stress hormone levels like adrenaline and cortisol. Um, and yoga can be seen as medicine, as it really allows us to optimize the function of everyday body systems, so muscles, digestion, circulatory system, and our immune system, promote physical and emotional well-being and spiritual resistance. And really engaging in the spiritual work of yoga, which can affect the body and calming of the body, leading to calming of the mind. And then that peace of mind sort of further impacts the body in terms of our circulation, digestion, and breathing. So it's sort of a cyclical process. It really supports the interconnectedness of mind, body, and spirit. And the evidence base for yoga, what we know is that yoga may reduce stress, lower blood pressure, reduce overweight, strengthen bones, prevent injuries, lift mood, improve immune function and oxygenation to tissues, and foster psychological equanimity and promotes spiritual well-being. And with its holistic emphasis on strengthening both mind and body, yoga can be a complement to a lot of conventional treatments and really help make the most of what you're able to offer to patients and families. It can allow you to use a smaller dose of medicine, for example, or it just can improve the quality of life, and has fewer side effects than many other therapies that we currently use. So I think there's a lot of different ways that yoga can heal, in terms of increasing our flexibility and strengthening muscles, improving joint health. I think this is really, really useful as we think of it, how we can bring this to our patients and ourselves. And it's also a pathway for life transformation. So, you know, most people know they should, stop smoking or eat lots of fruits and vegetables or whole grains or exercise regularly or, try to keep stress from getting out of control in their lives. But really the biggest barrier is actually implementing that. So yoga can be a way to help people implement the changes that they want to make. It can give you sort of greater control over your mind to address the samskaras or habits of action. And really practicing yoga regularly can allow that neuroplasticity to create new healthy samskaras or new habits that through repetition can replace the older dysfunctional ones. So just wanted to share a little bit on the literature of yoga and what we know. This is a study on prenatal yoga, and it's a systematic review of randomized controlled trials on the effects of prenatal yoga in PubMed. Only 8 studies were identified, but what they found is that prenatal yoga may reduce pelvic pain, improve mental health, physical conditions, and perinatal outcomes. And although this is promising, the authors really recommend that further studies are needed to delineate the health benefits of prenatal yoga. This is a study from 2022 that looked at the effects of yoga on cognitive functions and anxiety in female children with low academic performance. So this is one randomized control trial that included 89 children ages 12 to 14. And there were 2 groups, the yoga group, and then there was a group that had an exercise group in the school setting. And results showed that the yoga group showed improved overall general intelligence, visuospatial working memory, attention, and decreased anxiety. And this is a study looking a review of the literature of pediatric oncology that took place in 2021. And what they did is they reviewed the literature from 2010 to 2020 of all pediatric oncology studies and yoga. And 8 studies met criteria. None of them were randomized controlled trials. The recruitment rate was 34 to 55%, and the retention rate was about 70%. But what they really found was really good qualitative feedback that was very positive of the psychological and physical benefits, and certain measures of health-related quality of life, particularly anxiety, pain, and physical functioning, were found to be significantly improved following a yoga intervention. So the authors were able to conclude that although there haven't been any randomized control trials for pediatric cancer and yoga to date, but the delivery of yoga to this population is safe and feasible. And so what we know about the yoga research, then the limitations are that physical yoga practices are often combined with meditation and breathing exercises, which we know conceptually is a part of what yoga is all about. But when we look at the research, it's hard to compare different studies when you're using different modalities. There's also heterogeneity in study design, for example, the intensity or the length of the yoga intervention. There's heterogeneity in studied patient populations, and then there's fewer randomized control trials, especially for children. So the research is emerging, but still have a little ways to go. And then, just thinking about how we can bring this to our practice. And I was talking to a group a few weeks ago about how we could bring yoga prescriptions. And I know they're doing this in the adult world as well. But, thinking about a framework of, is this person, could they benefit from yoga? And are they willing to try a yoga session? And what are their needs? What kind of conditions are we looking to address? And of course, do they have any contraindications or injuries? And so, what's the right dosing? There's no specific guidelines. If someone's a real beginner, then you might want to just start with once a week, but you can always increase it from there, depending on how that person feels. But it can take a few weeks to really see the sustained effects of a regular yoga practice. And so, we can use yoga prescriptions for a variety of conditions. And for kids, anxiety, headaches, irritable bowel, functional abdominal pain, insomnia are some things that we see quite commonly. And so, for example, for anxiety, yoga can help kids turn inward and sort of understand their triggers for different kinds of behaviors. It can give them awareness of their breath, their thought patterns, and help them address their troubling thoughts and sort of slowing down that monkey mind, or the mind that's really always moving around and thinking of different things, and can contribute to a sense of hope because it's something that patients can do. They have some self-efficacy in being able to help themselves and heal themselves. So for example, for anxiety, if we're just thinking about asanas or the postures, just that part of yoga, certain asanas are helpful for anxiety, things like tree pose or side stretches, cross-legged twists, deep relaxation poses. But there's some considerations too. Sometimes when people have anxiety or depression, these can be very exhausting because there's a lot that's happening in their mind and body. And so sometimes just starting slowly can be really helpful. There's some asanas that may not be as helpful, including, back bends or inversions. And some pranayama or breathing techniques may not work as well. So really activating breathing where they have prolonged inhalation may not be as helpful. So really thinking about the kinds that have more prolonged exhalation. Also, for meditation, sometimes people with anxiety may have difficulty with closing their eyes. So it can be helpful for them to have their eyes open during the meditation. So just thinking about considerations as we use yoga as a form of medicine. Okay, and then I'm just going to touch briefly on hypnotherapy, which is another mind-body practice. Clinical hypnosis in children is really increasing over the past 30 years, even though it dates back over 200 years. And it's an adjunctive therapy used by pediatric health care providers to manage a variety of different conditions that they're already are, otherwise licensed to treat. So it really involves establishing a strong rapport with patients, and it's very individualized. So it is a little hard to conduct these randomized controlled trials in hypnotherapy. So, what is it and what it is not? It's not stage hypnosis, which some people have seen in movies or TV shows. What it is, it's really guiding people into a focused state of awareness that allows them to gain mental or physical control over their thoughts, behaviors, or actions. And although it doesn't work for everyone, everyone has the potential to benefit from it, but you do need to be able to be willing to focus your attention and follow the suggestions of a therapist. And contrary to popular belief, you cannot be hypnotized unwillingly, and you will not follow directions against your wishes. Um, but it's a tool that can help increase self-regulation, help a child to change their behavior or thoughts, and is, quite individualized to that specific child. So how it works, the child is in control, and the child uses their imagination to make changes in their thoughts, feelings, and behavior using specific language that the therapist uses and hypnotic technique and imagery. And so the clinician just really serves as a guide, a coach, or facilitator of the experience. And hypnosis is not really intended to cure a disease, but rather to relieve the symptoms of an illness, reduce stress in the body by increasing relaxation and offering positive suggestions and eliminating negative thoughts. So it also can affect the way that we perceive pain and allow us to control body reactions that we might not otherwise be able to control. And studies of functional MRI suggest there are changes in the brain when hypnosis is used for pain control. So it can be used for a variety of conditions, procedural pain and anxiety, headaches, abdominal pain, tics, nausea, enuresis or bedwetting, insomnia, and difficulty with taking medication. So kind of a variety of different ways that we can use hypnosis for common pediatric conditions. And this is a review article where studies were examined in which hypnosis was compared with a control condition or an alternate intervention in reducing procedure-related pain for patients younger than 19 years of age. So they did a huge search. They found 13 articles satisfying the criteria. And what they found is that when hypnosis was used, hypnosis was consistently found to be more effective than the control conditions in alleviating discomfort associated with things like bone marrow aspiration, lumbar punctures, avoiding cystourethograms, and post-surgical pain. So it wasn't that hypnosis was used alone; it was just used, in combination with other things. So it was more effective than just the current way that they were using procedural pain management. So it's promising, but more studies really need to be done with more rigorous methodology to give more robust evidence for the use of clinical hypnosis. Although many of us are using it because we know that it works and we're finding it helpful, and there are fewer side effects. So one of the techniques that some of us are familiar with is a magic glove technique, but it can be used for inserting IVs, for injections. I've used it for immunizations. It's ideal for kind of kids 3 to 11. And parents can learn how to do this too, which is really helpful. And most importantly, the kids can learn how to do this so that if they need to do it on their own at any time, it's really helpful. But it's a way to kind of allow them to feel that their arm or their hand is getting protected. And we use certain hypnotic language for that, and sort of allow them to use that sort of protection whenever they need it. If anyone's looking for a good book about hypnosis with children, the Cohen and Olness book is great. And also, if anyone's interested in training, my training was through the National Pediatric Clinical Hypnosis Training Institute, NIFTY, which has it's in Minneapolis. They have workshops every fall. I think they're having it. They just had it last weekend, but they have different levels, level 1, 2, and 3 of training for pediatric clinical hypnosis. And it's a really wonderful workshop with really dedicated and experienced clinicians teaching. Okay, so just briefly want to go over a little bit of current and future directions of where we are with mind-body medicine, particularly at UW. And so we, as Lisa mentioned at the beginning of our time together today, the UW Mindfulness Program has a robust offering of many different programs. I wanted to mention that the mindfulness-based childbirth and parenting program, there's going to be, Lisa just mentioned that there's going to be another offering in the spring of 2025. And in the past, there's been specific mindfulness for teens and mindfulness for middle schooler courses. And this year, there's going to be a half-day retreat for youth, either this fall or early next year. In the past, we've had mindful families classes and mindful parenting retreats. That have been helpful. And if anyone wants more information about these classes, please contact Lisa Thomas Prince and stay tuned to the UW Mindfulness website. And we're hoping to have some pediatric mindfulness-based group medical visits starting up in early 2025, and then a UW pediatric mind-body clinic that is currently being developed. And I just want to also circle back to some of the things I've talked about in terms of health equity. I think we have a great opportunity in integrative medicine to see how we can address and mitigate the accessibility or poor accessibility of mind-body therapies to make sure that everybody can access these. This is especially important since we have a shortage of mental health providers in our country, and often children in certain areas or rural areas even have more limited access to healthcare providers. And, you know, we can actually mitigate some of these disparities when therapies are taught and implemented at the school or community level, or in group settings like group medical visits, where we can offer an additional opportunity for people to connect and have that social support. And then mind-body therapies in general can also give people a mastery of skill in a particular in art or a movement, or can foster resilience by being proactive rather than reactive. So just wanted to mention that, as well as where are we at with our current research funding? Well, I was just looking this up, and it was really interesting to see that the NIH only has about 27 projects that are focused on mind-body interventions for youth and parents. And the National Center for Complementary and Integrative Health only has 19 funded projects for mind-body interventions in youth of 462 projects. So really more funding is needed to study mind-body therapies in children and youth. And then in future research directions, I think one challenge is really to identify the specific aspects of the mind-body programs that drive the therapeutic effects. So what in particular is leading to the therapeutic outcomes. And then it's kind of unclear how these techniques will work at the neurobiological level. So really a foundational understanding is critical to developing more targeted and effective interventions. And also more work is needed to identify which populations will benefit most from certain types of interventions and which intervention types are most effective for different populations. And then also thinking about, how much is required to achieve the desired outcome. What's the optimal dosage or modality? Is it yoga or seated meditation, and how often? And I think research can also help us answer whether these interventions result in clinically significant, not just statistically significant, but, does this make a real change in the lives of children and families? And It's really important to consider accessibility and affordability as well. And then we do need more randomized control trials to be able to bring this evidence-based practice to clinical practice guidelines and bring it more to mainstream medicine. So just a summary of everything we've talked about today is the evidence really varies in terms of the quantity and quality, but generally the evidence base is building and supportive of mind-body therapies and practices as being safe and potentially effective in common and debilitating conditions, including pain and anxiety. An additional potential benefit for school-age children include improved concentration and self-esteem. And pediatric healthcare providers are encouraged to really facilitate an open dialogue with their patients about the use of complementary therapies and to become familiar with mind-body therapies and practices as non-pharmacologic options to improve mood, behavior, and quality of life, which are of great interest and real relevance to children, youth, and their parents and caregivers. And then there are many resources for families now, apps and websites, UW mindfulness program classes, and now starting with some group medical visits. So thank you very much. I really appreciate everyone's time this morning. And I will go ahead and stop sharing.